Hello all, just wanted to do a short video on hip fracture, all that you need to know. So let's take a look at this skeleton. You see the pointer here. So the hip is actually encompassed by the femur and the pelvic bones here, the two halves. So if we drop down, we can see the pelvis here in this animation. So the upper femur is broken up into four parts. We have the femur head, which is kind of moves in that ball and socket area, the neck, the trochanter area, so we have the greater and lesser trochanter, which are essentially bone points for muscle connection to move the leg, essentially, and then the subtrochanter area. The two main areas that are fractured is the femoral neck and the intertrochanter area. That's what we call a hip fracture. So if you come over to the right, these animations here, this is in the neck, this fracture in the neck. Drop down one, we have it through the trochanter area. These are 90% of hip fractures. So the most common cause is a fall from an elderly person with osteoporosis, or a motor vehicle accident where actually the knee can hit the dashboard, etc. So what is the real issue with the hip fracture? Things that can cause long-term complications. We have something called avascular osteonecrosis, and this is just with avascular, without vessel, essentially, osteo, so bone, necrosis, dead bone. So drop down and look at this picture of all the arteries here lying over the femoral neck, the trochanter area. What they're not showing very well is this foveal artery here that actually comes up the middle of the femur head into that ball and feeds the top of this femur head. If we disrupt the neck or the head, we have a high risk of breaking through these vessels and causing cell death, because bone is living cells that can cause all kinds of complications. If we drop down to this picture on the right, I brought up an x-ray showing the complication of osteonecrosis. You'll see me circling the left hip here, and you can see how the femur ball here doesn't look right. It's smashed, it's oblong, and the bone here in the acetabulum, which is the ball of the ball and socket, looks distorted and ruined. Essentially, this ball and socket no longer works like a ball and socket. You can imagine how painful that is. Now compare that to the right hip of this person. The ball's nice and round, the acetabulum's kind of surrounding the bone well, it's healthy. There's no arthritis here. There's lots of problems here. So this is if you drop up or go up to the x-ray here, this is healthy. See these margins, how nice this looks here? Running along the acetabulum, the femur, no signs of neck injury here. So the other problem is, if we break up these arteries, is all the bone is living cells. We can develop a fracture that does not heal. And you can imagine how painful that would be, how you couldn't walk on that, etc. The other high-risk issue with a fractured femur is the risk of developing deep vein thrombosis, clotting, as we rupture the veins, which aren't showing here, and the arteries, and we're laid up. And the surgery itself increases the risk of formation of a DVT, a PE, pulmonary embolism, etc., etc. So most people go on heparin, a blood thinner, when they're getting close to or after surgery, once it's completed. I wanted to view a couple of x-rays showing the displacement or the fracturing of the hip. So on this is a right hip. Here's the acetabulum, part of the pelvis. Here's the femur head, the neck, the trochanteric area, subtrochanter. So where do you think? The arrow's pointing right here. We have a neck fracture. Okay, now move to the right. So we have the acetabulum, we have the femur head, we have the neck. Look at the trochanter. The greater trochanter is displaced. This trochanteric fracture actually is displaced. It's overlapping here. Here's the lesser trochanter. Now compare that to the picture on the right, or my left. Lesser trochanter, greater trochanter, trochanter solid. Come back over. Uh-oh, we've displaced this. So that is the two most common fractures of the neck or the intertrochanter area. So how is this fixed? Well, depends on your needs. I'm not an orthopedic surgeon, but I have cared for a lot of patients that have arthritis and have developed femur fractures, usually from osteoporosis. So there's a couple ways this is fixed. We'll drop down to my left here, your right. Hip replacement arthroplasty. So that's a famous name for basically replacing the hip with metal. We have two kinds. We have the total hip and we have the hemoarthroplasty, which is a partial hip. Both receive basically metal that's wedged into the femur. They remove the femur head and neck on both of these. The difference is on a total hip, the acetabulum is replaced. See that? Where that socket, where that ball is going to go in that socket. Over here, they've retained the acetabulum. The socket essentially is still good for the ball to move on. So this is a hip replacement, total, partial. Now move over to the right here. We have three pictures, but we talked about the most common fractures are the neck or the trochanteric area. And these are basically pinned, which are just screws that are placed in to pull it back together. You can see this actually has a brace as the trochanter, and you can imagine the pressures here. These connect muscle, so including the glutes to move your hip back and forth. There's a lot of strong muscle tying into this. That's why it requires a little bit more anchoring in the trochanter area versus the neck itself. I brought up some x-rays here to show what this looks like on x-ray after the total hip. So this is total hip. We have the acetabulum, that ball and socket area. So this is the ball. Whoops. Sorry about that. Let me pull this back up. There we go. So we have this socket that's been created. A lot of these are ceramic coated, screwed into the pelvic area. Same here. And then we have the removal of the neck and the femur head and the metal wedged into the femur itself. Over here we show a screw. Appears like the fracture is running here on the neck. You can kind of see that. And they've braced that. Actually, it could be back in here in the trochanteric area more than likely. It's hard to tell. I'd have to look at more x-rays. But essentially, they've plated this and pulled this together, which this is usually done if there's a trochanteric trochanter fracture versus the neck fractures. So that's what that kind of appears like. If you have any questions, let me know. Thank you very much.